This is our second video for infant social emotional development, and I wanted to take a couple minutes and talk about sleep training. So a common technique is called Ferberizing, or you might have heard it as a cry it out technique. In 1985, Dr. Richard Ferber came out with this technique. This is essentially just letting the baby cry itself to sleep. Ferber actually advocates going back to the baby periodically, but increase the amount of time you wait to go back every time. So maybe first you go back after 5 minutes, and then the next time you go back after 7 minutes, and then 10 minutes, etc. He says to reassure the baby by patting its back, but do not pick it up and leave before the baby goes to sleep. Ferber methods encourage leaving the baby to cry, even if to the point of vomiting. In other words, ignore the child's cues of distress. Some sleep training advocates take this further and say never go back. Essentially put the baby in his crib, leave the room and close the door, and don't go back until the baby goes to sleep. Many professionals still advocate this practice, and you'll still find a lot of it online. So what are some of the arguments they use? They say the baby will never learn to self-soothe if you always do it for them. And babies need to learn to put themselves back to sleep when they wake up alone in the middle of the night. However, this should never be done earlier than 6 months old. Most babies still need to eat at night, and ignoring their cries at night means depriving them of food that they still need. This is a very controversial topic, and advocates for either side, either for it or against it, are very adamant and very persuasive that their view is correct, and both sides will show you the research that supports their view. They won't show you any of the research that goes against their view, just the research for their side of it. So let's talk about it a little bit. Now, before we talk about this, realize that there's a big difference between crying it out and crying it out alone. Holding a baby and letting it cry while in your arms is much different than leaving it alone in a dark room by itself. Babies who do sleep train do fall asleep faster and sleep longer. So there is evidence to show that parents who use sleep training do have babies that fall asleep sooner and they sleep longer. But crying is how babies signal that they are in distress and need help. It's their only form of communication. A lack of crying does not necessarily mean a lack of distress. Some babies cry when they're in pain, some don't. Temperament plays a role. If baby's cries are responded to during the day but not at night, the baby can become confused. Night is when baby feels most vulnerable, especially when alone in a dark room. And babies lack the ability to self-regulate. They can't regulate their emotions at all. So when left alone under distress, they do not calm down, they shut down. Think of it from a survival perspective. A baby is crying and a caregiver doesn't respond. Therefore, baby is alone and vulnerable. Baby needs to shut down and be quiet so a predator doesn't hear them. Leaving babies alone to cry is a good way to make a less intelligent, less healthy, but more anxious, uncooperative, and alienated person who can pass the same or worse traits on to the next generation. Using cry it out, you're more likely to foster a whiny, unhappy, aggressive, and/or demanding baby. One who has learned that one must scream to get needs met. A deep sense of insecurity is likely to stay with them for the rest of their lives. So what are some of the effects on the brain? What has neuroscience shown us? Brain research has shown that when babies cry, cortisol levels increase in both the baby and the mother. So both baby and mother get more stressed out when baby cries. They're in sync. Even when baby learns that crying does not help, their cortisol levels still increase. So even if they're laying in their crib alone, even if they're not crying, we still see cortisol levels increase in their brain. But since the mother does not hear the crying, the cortisol levels do not increase in her brain. And this leads to a disconnect between the mother and the baby. Prolonged exposure to cortisol can lead to metabolic changes and can result in maladaptive coping behaviors. A lot of cortisol in the brain, especially if it's every night, can really affect the brain, can make the brain worse. So, the jury is still out on this, mostly due to the lack of properly controlled experiments. It's very hard to do an experiment on this issue because of ethical issues. But based on what you now know of attachment and Erikson's first stage of trust versus mistrust, how do you think this technique affects the baby's view of the world? I'm going to put this discussion up on Blackboard, and I'm really interested to see what you think. One of the best quotes I've heard about this technique is when babies lay in their beds alone and they've learned to stop crying. The quote is this: "The need is not gone, only the trust." So please contribute to this discussion on Blackboard. Babies cannot and do not manipulate. They communicate, listen. They lack the cognitive ability to manipulate. Their brains are not sophisticated enough. They're not crying to manipulate you. They are crying because they are trying to communicate. We're going to switch gears to emotional development now. So what is emotion? It's one of those things that we know what it is, but it's hard to define. There are three aspects to an emotion. There's a physiological change, such as sweating, increased heart rate, breathing rate. There's something that happens in the body when you feel an emotion. There's a subjective feeling. So how do you interpret those physiological changes? Do you feel sad? Do you feel happy? That's subjective. And then there's an overt behavior or expression. What do you do with that emotion? Do you smile? Do you cry? So an emotion has all three of those components. So I have an emotional development video that I think explains emotions pretty well. Please pause my lecture and go watch it. Okay, so basic emotions. Babies are born with discrete emotions that differentiate over time. So most studies have found a set of basic emotions. Now, different research will identify different basic emotions, but the general consensus is for the following. Babies are born with these emotions: anger, disgust, fear, happiness, sadness, and surprise. So most researchers agree that these are the emotions that we are either born with or that develop within the first year of life. So development of new emotions are linked to cognitive and social experience. Those are the advanced emotions. For example, you can't be jealous until you have object permanence. You can't feel shame until you have a sense of self. And those things happen later. So I want you to watch the Disney Pixar movie Inside Out and send an email to me detailing the ways the movie relates to class material. This movie had psychologists consult with it, so it's actually a very accurate movie. So I would like you to watch it and see how it relates to the things that I'm teaching you. Okay, expressing emotion. So the first thing an infant can express is comfort and discomfort. So discomfort might be pain, hunger, things like that. So at first, this is really the only thing newborns feel. They express discomfort or pain by crying. Soon they begin to display other emotions such as curiosity and happiness. They'll laugh and smile, and they prefer to look at happy faces over sad ones. So they develop something called a social smile. This appears around 6 weeks to 2 months old. This is a smile in response to another person. So this is like when they see mom or dad's face and they break out in a big smile. It's the cutest smile in the world, and most parents love it when babies do this for the first time. Smiles before this age, though, are reflexive or imitation. They're just practicing using their facial muscles, and they don't really mean anything. We don't really see a real smile in response to happiness again until about 2 months old. Anger and sadness, these usually appear around 6 months old. They usually occur in response to frustration, being able to get something that they want. We also see fear. Fear usually manifests in separation anxiety, so they're clinging to their caregiver when they're about to leave. Remember, separation anxiety is completely normal. It's related to attachment. The worst part of separation anxiety is usually around 9 months old. That's when they're getting object permanence and their attachment to a single caregiver. And it seems to subside after the age of 2. But again, it's perfectly normal. We also see stranger wariness. This is a fear of unfamiliar people. At first, babies don't have this. They don't recognize the differences between people. But this is also related to attachment. As they attach to the caregivers in their life, they start to be afraid of people who aren't those caregivers. So let's talk now about some of the more complex emotions. So self-awareness. Before 5 months old, the infant does not realize that he is a separate being from his mother. To the baby, mom and baby are essentially the same person. There's a test they do that I'm going to have a video for you later. They show the baby a mirror and they put a dot on the baby's nose. Infants don't touch their own nose until about 18 months old. So they don't recognize that the baby they see in the mirror is themselves until they're about a year and a half. At 30 months, they can point to a picture of themselves and use their own name. So self-awareness is something that develops gradually, and it leads to the development of complex emotions such as pride, shame, embarrassment, envy, guilt, empathy. So I have those here. So these are some of the more complex emotions that depend on a sense of self and an idea of object permanence. Some 5 and 6-year-olds feel regret and relief. Most children feel this by age 9. Children will feel guilty when they do something they shouldn't, and pride when they accomplish a difficult task. But these don't develop until about 18 to 24 months because they require that sense of self. You can't feel embarrassed if you don't care what people think. So emotion and attachment. Emotional IQ. We hear a lot about IQ, which is based on cognitive intelligence. Emotional IQ, otherwise known as EQ, is a measure on someone's emotional intelligence. So EQ is based on baby's earliest bonding experiences, attachment. Early emotional learning is predictive of later social behaviors. So part of EQ is how you express emotions. Are you able to recognize your emotions and know what sad is, know what angry is, know what happy is? Can you regulate your own emotions? And can you recognize emotions in yourself and others? Do you know what you're feeling, and do you have the empathy to see what someone else is feeling? All of these are part of emotional competence. Children have a very difficult time with this, and some adults still struggle with it. So how is this related to attachment? Well, insecure resistant children show more fear and less joy. Fear is the most powerful emotion for them, even in situations designed to evoke joy. But securely attached children have less anger as they age. Children who are insecure avoidant grow more fearful, and insecure resistant grow less joyful. So your attachment can change the emotions that you feel as you age. At 33 months, secure children were less likely to show fear and anger. And children with secure attachments have higher levels of emotional competence. Social referencing, this is seeing another person's perception of a situation to help us form our own view of it. So this is when you're in an unfamiliar situation and you look around to see what other people are doing before you decide what you're going to do. So infants show this as young as 6 months old. They'll use the caregiver's expression or tone of voice to tell them what to do. They see something new and they look at mom to see if they should be afraid of it or not. And children are more likely to look to an attachment figure for cues on how to react. Someone used the visual cliff experiment to see if the social referencing could change whether or not the baby climbs over the visual cliff. So I want you to follow this link and watch this experiment. So emotional regulation. In infants, again, they don't have it, but they have some very primitive strategies. Their strategies when they're feeling uncomfortable are to look away, to suck their thumb, or move closer to a parent. Studies show that emotional regulation can be linked to attachment. Adolescents who were secure as infants are the most capable of regulating their emotions to interact cooperatively with their friends. Preschoolers with insecure resistant attachments engage in more conflict with siblings and show greater hostility. So attachment does influence how well you can regulate your emotions. Babies even hours old can mimic facial expressions and gestures. Babies form mental images of appropriate behavior as a result of interactions with their caregivers. The frontal cortex makes a big leap at around age 1, and this helps them regulate their emotions and their behaviors. However, once again, the frontal cortex does not finish developing until your mid-20s, so emotional regulation remains more difficult for children than adults. So as we age, we get better techniques at regulating emotions, and some children are better at it than others. And having good emotional regulation makes you more popular with your peers. However, it is a skill that needs practice and guidance. A child left to his own devices will most likely not develop healthy emotional regulation skills. If you're interested in this, the book The Whole Brain Child talks about how to help children with these skills. All right, we will continue in the next video.